Hello, good afternoon, and welcome to this afternoon session of the Info Day of Cluster 1 Health of Horizon Europe. We will start with the question and answer session on Destination 4, ensuring access to innovative, sustainable, and high-quality healthcare. My name is Carmen Laplaza Santos, and I am the Head of Unit of Health Innovations and Ecosystems in DG Research and Innovation. And today, I will be, for this session, I will be helped by my colleague, Annika Stjernkist, who is the destination leader of this destination, and by Rosana Damario, who is the Policy Officer of International Cooperation in Health. So under Destination 4, activities focus on health and care systems. The expected impacts of actions under these destinations should contribute to health systems that are more effective and also efficient, that are more sustainable, accessible, and also resilient, where healthcare providers have the necessary skills and competencies, and where also patients are empowered in order to take care of their own health management. We also consider the needs in this destination of informal carers and people in vulnerable situations. And that's precisely the topic of, that's the topic that will be funded in 2024 World Programme that precisely will focus on the needs of people in vulnerable situations. A two-stage call with a first deadline in September, 19 September 2023, and a second deadline in April 2024 for the successful proposals that will pass the stage 1. The total budget allocated to this topic is 30 million, and the project size expected between 4 and 6 million. It is a research and innovation action. I hope that you had the opportunity to watch at the video that was prepared in advance, where more information about this topic was provided. And now we can already start with the question and answer session. Just to remind that we will focus on the content, as cross-cutting issues have been the target of a session that took place early this morning. You can always watch it, and in case you have questions on this regard. I'm going to read the first question that appears here in the Slido. Is it enough to examine people with only disabilities based on the different perspectives mentioned in the call? Not all groups that are mentioned in the call? Annika, I don't know if the question is clear for you.
Yeah, I think so.
Okay.
So what I can say about this question is that when we drafted the topic, our aim was definitely to have different projects focusing on, for example, one single group. So disabilities could be one group in focus of one project. But it's also important to say that after we draft the topic, it's not in our hands regarding evaluation, etc. So it will be evaluated by external experts, and they will evaluate it based on their interpretation of what we've written. So that's also important to remember.
All right. There is another question also a bit similar, which is around, well, they are asking whether they can focus on one type of vulnerable groups, such as migrants, either regular or irregular, or they have to cover all vulnerable groups.
Yeah, so like you said, very similar question. It was not our intention to only fund projects that focus on all the groups we mentioned. It's that could be the focus of a project, and I mean, based on what we wrote, at least, that could be the focus of a project, and it could also be separate projects focusing on different groups. And I can also add that the list of groups is most likely not exhaustive. So either if you focus on one of the groups or all of the groups mentioned, or you have another group that you see would fit this, what you have to do is, of course, to motivate and explain why this group is considered as being part of these people in vulnerable situations and why there is a big research need for this group.
Indeed, I think this is very clear as an answer. So you don't have to focus, there is no compulsory obligation to tackle all vulnerable groups. That would be quite complicated indeed, but it's not forbidden either. So another question, is it advisable to contact the initiatives and projects mentioned in the call, such as, for example, the Transformation Healthcare Systems Co-Fund, and ask for a letter of commitment? No, I don't think it is necessary to contact all those initiatives. It could depend on the nature of the activities of the proposal, what would be the main focus, and whether the activities that are already done by these different initiatives that are mentioned in the topic, if it's relevant in the context of your proposal, whether there could be synergies or overlaps with your work and the work that these initiatives could be doing, it would be important that in the proposal you specify how would you ensure that you would be linking with these initiatives in order to avoid overlaps and to maximize impact. So I think that to be maybe clear in the answer, everything depends on the focus of your work and how relevant would be collaboration with the activities of those different proposed already initiatives ongoing mentioned. As you know, synergies is very important in Horizon Europe, and that's why in case there could be synergies, it would be important to ensure that they will happen. So that's why we listed a quite important number of initiatives, but it does not mean that you need to ask for letters of commitments or that you need to synergize with all of them. So just when it is relevant. There is a question which is maybe not very clear. I'm going to try to, it's saying, does it have to be one of the groups mentioned? I guess they are referring to the vulnerable groups mentioned. Annika, I think you already answered to these questions by saying that, of course, the list was not exhaustive, so they could find additional groups of people that would be in vulnerable situations that were not contemplated. But of course, we have try to be as comprehensive as possible. So in case you see that a group was not considered, as Annika said, you could really need to motivate the reason why you chose and why this particular group have difficulties to access healthcare, which is the main focus of the topic, and where research and innovation would be needed. Annika, I don't know whether you want to complement that.
No, just to emphasize again that, of course, even if you do decide to focus on one of the groups that are mentioned, you still need to motivate why you focus on this group. So it's the same either way in terms of your preparations for the proposal. But of course, also just to confirm again, as Carmen said, that it does not need to be one of those groups. Just make sure that you motivate why this group is of relevance.
Good. Another question. Does the range 4 to 6 million mean that 4 is minimum and 6 is maximum? No, actually this is indicative. This is our own estimation on what could be a reasonable size of budget necessary in order to achieve the outcomes that are expected from this topic. However, the budget needs to really be consistent with the activities that you will include in your proposal. And obviously, you have to convince the evaluators that the amount you are requesting makes sense and is really necessary to do what you are committing to do. So in this regard, you can request less or more as long as it is sufficiently justified in the proposal. So just to be clear, the figures are only indicative. Okay, a question now in international cooperation. So for Rosanna, so we are being asked whether it would be possible for African countries, partners, to participate. I guess it means for partners from African countries to participate.
Yes. So, of course, yes, it is possible for participants from African countries to participate like any other third countries, so countries that are not member states and associated countries to Horizon Europe. Of course, it depends on the role that they have on the proposal, but yes, by a participation point of view, they are absolutely eligible and welcome.
Thank you, Rosanna. I don't see any other questions for the time being, so I would invite our audience to be active in the Slido. This is a very good opportunity to have us reacting directly on your questions. And I see one now. Great. I will read it. The data sources for health project are usually with a long agreement process. What are your advice and standard? Annika?
Yeah, I'm not sure I completely understand the question, but I can try. And I mean, so as you know, this we opened the proposal process now, and the last deadline is in almost a year from now, and then the project might start at the end of next year. So there should be some time to work on this. If there are long agreement processes, I don't know if that is helpful.
Well, I would invite whoever asked the question maybe to precise it a little bit more. Otherwise, of course, it is always possible to address questions through a written form that we will answer and include in the frequently asked questions. So in case the answer was not clear, please don't hesitate. I must say that it was not fully crystal clear for me neither.
Maybe we can also add that there are also these national contact points in every country. So if you reach out to the one from your country, for example, to discuss this question, they could put you in contact with someone who's already involved in another health project where data sources are used. So you can probably get some support and input from someone who's already done this.
Indeed, thanks a lot, Annika. Actually, yes, you were right to refer to national contact points, which are extremely useful to support you in this question or in another kind of question. And maybe I will remind that there was a session this morning where representative for the national contact point address and provide the specific information about how they could support. I don't see any other question. So I hope I will give a little bit, a few minutes maybe for other questions to come. So please don't be shy. Maybe I will just say that this topic is very important for us. As you know, the treatment of inequalities in healthcare is a critical point for us in the context of Horizon Europe, but also for the Commission. So this is one of the topics that it's supposed to contribute to the fight against inequalities. All right, I see a question now. Does access to health and care include e-health, lot and remote systems, between brackets? Again, not sure whether I do understand exactly what does it mean about lot and remote system. But Annika, does access to health and care include e-health?
Yes, I would definitely say so. We say that, I mean, you can focus on different parts of the healthcare system. So it could be a specific type of service related to a specific type of disease, or as in this case, maybe more a sort of level of healthcare, maybe e-health could be called. So yeah, I would definitely say so. Just again, make sure that you motivate why this is of relevance, of course.
Yeah, in this, obviously we are moving to a more and more digital society. And in this context, e-health, I mean, healthcare provision that would be facilitated through e-health, through digital means, should include as much as possible so vulnerable situations. So in this sense, I could say that whatever the way healthcare provision is done, the needs of people in vulnerable situations should definitely be considered. Annika, as topic writer, is there anything else you would like to say to reinforce around this topic while we maybe wait a little bit to see if any other question comes?
No, nothing that comes to mind. We're very excited to see what proposals will come in and what we will eventually fund. It's such an important area and such an interesting field for research and innovation.
Indeed, actually, it's also quite new. Like the destination health and care system, it's a new destination or a full destination per se since Horizon Europe, what gives an image of the importance that we are giving to this area of research around healthcare systems. But anyway, I think that no other questions are coming, so maybe we can close the session. For that, I would like first to thank you, the panel, to thank you, Rosanna, and a question came. I'm very happy about that because we still have 5 minutes. So do you consider data sources from hospitals, health facilities, from old projects as a must for a proposal, as a better advantage or connection to an old project?
Maybe you can also help me here, Carmen, but I would say that in general, it's not that we would give an advantage to one proposal just because there is a link to a previous project. But what's important is, of course, again, that the relevance of the proposal. So if that helps to show why this is very relevant, that you build on something that, then that's, of course, a good thing for the proposal, but not per se because it builds on a previous project.
Absolutely. There is no at all an advantage of doing something that is a continuation. However, in case it would make sense to build on existing work that has been funded by the European Union, or as I was saying, synergizing with ongoing initiatives, then obviously it would be important to do it. So everything, as Annika said, will depend on the focus of your proposal. But you don't have to specifically look for something that is building on old or ongoing projects. So 2 more questions have came. One is about what about a specialist education for doctors to fill the gaps?
I'm not sure I understand again really what this question would be about.
Yeah, it's a bit maybe broad. What I would say, and I will let you complement, maybe is that obviously healthcare professional having the relevant possibility to their work as best as possible, it's important in the context of this destination, so as to have the necessary skills and competencies. So if that would be needed in the context of access to healthcare by people in vulnerable situations, then yes. But the question is not that clearly phrased as to be able to provide a very concrete answer. I don't know, Annika, what do you think?
No, I'm not sure either how to reply to it. Sorry.
Yeah, so I guess the answer would be depending on the rationale of the concrete proposal. Maybe we can move to the next question, which is asking: would access to health and care services include access to therapeutical drug monitoring, advanced therapy that may help to improve treatment?
Yeah, tentatively, I would say yes. As we say that all parts of the healthcare system can be included.
Mm-hmm. If letters of intent are appropriate, do they belong in the first or second stage? I don't think there would be enough space in the first stage to include letters of intent, because it's quite limited. So I would say that certainly not to the first stage. And then on the second stage, I think that would depend on the concrete proposal, but in principle they are not compulsory, and there is also a limitation of pages. So I think it's up to you to judge to what extent this could reinforce and make your proposal stronger, but they are certainly not a must. I don't know if Annika or Rosanna, you want to comment on that question.
No, it's okay.
Okay, so I think I don't see any other question. So I will continue thanking our panel as I had started. So I would really like to thank you, both Annika and Rosanna, for their help answering the questions. I would like to thank you, our audience, for having been very active. And now, just to tell you that I wish you the best of the success for the preparation of your proposals. Thank you and have a nice afternoon.
Thank you.